Good afternoon, everyone. Thank you for joining us today for our first for our clinical trials methodology course webinar. It's on specific games. I think we will get started. I'd like to introduce our speaker today. It's Dr. Robert Silbergleit from the Department of Emergency Medicine here at the University of Michigan. He has expertise in organizing and conducting clinical trials in the acute care setting. He has substantial experience as a translational researcher, working on laboratory animal models of brain injury and participating in clinical trials in stroke as a site PI and co-investigator. For the past 10 years, he has been a leading co-investigator in the formation and organization of the Neurological Emergency Treatment Trials Network, and most recently, the Strategies to Innovate Emergency Care Clinical Trials Network called SIREN, where he contributes to the oversight and management of all SIREN-net trials. He developed specific expertise and experience in investigating initial interventions in patients with status epilepticus and neurotrauma. In multiple trials, he has developed operational and academic expertise in exception from informed consent for emergency research and its conduct under FDA regulations. He is also PI of an NIH-funded empirical ethics project to study the review of local context by local and central IRBs. So thank you again, Dr. Silbergleit, for joining us today and presenting on specific games. If everyone could just remain on mute, and then we'll save questions for the very end. So thank you. Robert, are you ready?
Okay, can you hear me now?
Yes.
Okay. Great. Well, thank you for that introduction. I think what you didn't hear in that introduction was anything that would make me especially qualified to talk about writing specific games. So there's a lot of things that I could be lecturing on that I think I might be more obviously expert in than this. I can say that my credentials for talking about writing specific games are really limited to the fact that I spent about 6 or 7 years on the NINDS NSDK study section, which is the NINDS study section that does all the clinical trials. And in that period of time, I read a lot of specific games pages. And I think that really is about all the credentials I can have. I can say that in over many years, I've also written a lot of specific games pages, some of which were for grants that got funded and many were for grants that did not get funded. So I think that in and of itself is probably not a very good credential. But I can definitely tell you what I and others liked or didn't like in specific games pages that came to our study section over many years. I have no disclosures relevant to this talk. So the objectives of this talk, I'm going to really break it down into a few components. And I think that this could be one of the shorter webinars, and hopefully we'll have lots of time for discussion if people have things to discuss. What I really want to emphasize in this talk, for the most part, is the importance of the specific games page, because it really is a critical element of your grant applications, a critical element of really putting your research design together and convincing other people that it's important. And then we're going to talk about some of the hardest parts of writing the specific games page and what you might be able to do about it.
Can you forward the email to Jean
and somebody is unmuted that needs to be muted. And then for the third part, I'm going to suggest a structure for a specific games page that you could use. I can tell you right now that that'll be the more subjective part. I think that everybody agrees that the specific games page is important, but not everybody agrees on how it should be structured, but I'll tell you what works well for me. And then we'll have some time at the end to discuss examples, and I've got a link to a PDF that I can provide that'll give us some examples we can talk about if we have time and interest. So let's talk about the specific games page. And really, the specific games page is your chance to do an elevator pitch. It's often going to be the only part of your grant application that people read. And why would that be the case? And it's really because of the way that the NINDS reviews, or NIH reviews really, all the NIH reviews work. And the way that it works is that on a panel, you're going to be assigned to a panel of 20 reviewers that are going to score your application. And one of them will be assigned as your primary reviewer. One of them will be assigned as a secondary. Usually there will be a tertiary and a statistical reviewer as well. So there would be maybe 4 people, sometimes a little more, assigned to your grant application. The people who are assigned to your grant application, you can be pretty sure are going to read your grant application from snout to tail. They'll look at the whole thing. They'll read it thoroughly. They'll understand it, I hope. And they may read your appendices. The appendices are much more limited than they used to be. But those people can be relied on to have read the whole grant application. The other 16 people on the review panel are going to hear about your grant application from those reviewers. So the primary reviewer will give a score and a detailed explanation of what they thought about your grant application. The secondary person will add the additional elements that they thought were important, and the third and the fourth. And then there will be a discussion among the whole panel. Typically, during that discussion of the whole panel, the other members of the review panel are going to bring up your application on their screen, or maybe they'll have printed it out, and they will be looking through your grant application, often for the first time, because they were assigned other grant applications. And the thing that they're going to look at is your specific games page. And it's going to be your chance in that room to be selling it to those 16 people independently of what the reviewers have said. And that's probably all they're going to do. Now, they might flip through, different people do different things. They might look at your specific games page while the discussion's going on and flip through to your figures or your methods. But pretty much everybody's going to be looking at your specific games page for the first time in that review panel, and it's your chance to hit those people. And even though only those 4 people might have read your whole grant application, everybody on the panel votes, and nobody's vote counts more than anybody else's vote. So your specific games page really is your sell to the majority of the review. So that's one of the things that makes it critically important. The next thing is related to what this guy says. And many years ago, I wouldn't have needed to say who this is. Everybody would have recognized this as Will Rogers. Nowadays, you sort of have to tell people. And Will Rogers is famous for saying many, many things. But one of the things that he's famous for saying is that you never get a second chance to make an impression. And there's no question that that's true about your specific games page as well. So independent from the fact that all these people are going to only look at your specific page, even the 4 people who are your reviewers, who you're really selling to, they're going to read your specific games page first. And what we know is that Will Rogers wasn't just homespun wisdom, but we now know from cognitive science that what he said is absolutely right, that most people make decisions in a fast-thinking, snap judgment sort of way. They read something quickly, they look at it, and they make an opinion, and then they spend the rest of their time going over this question trying to rationalize whatever decision they made in the first place. And so your chance to get the reviewer hooked, engaged, interested, excited about your project comes from this initial look at the specific games page. If you get them interested, they will read the rest of your grant application looking for reasons to like it, looking for reasons to support it. If on first glance at the specific same page they're disinterested, bored, critical, do they disagree, then they're going to read the rest of your grant application looking for reasons to not approve it. So there's no question that first impression, that hook, is key. The third reason that makes it important is that it's sort of the page that people look at most often. And the reviewers, at least the way that I review a grant application, and I think many others do the same thing, is that you look to the specific games page to map out the project and the 12 pages that follow. And as you start getting into the 12 pages that are, dense, detailed, data-laden, methodologically complex, when you get lost and you say, what are we trying to do here? I'm sort of confused. You go back to the specific games page and try to figure out exactly what they're saying and how it relates. So if you have a map in your specific games page, if you make it clear there how everything else that you're going to unpack in your 12 pages relates to your goal, to your purpose, then going back to the aims page will reorient the person and get them to understand what you want. In addition to that, it offers a chance to hit on specific elements. So one of the things that you want to do for your reviewers is make it easy for them to fill out their review after they've read it and like it or dislike it. And when you fill out a review, you're going to go through the innovation point, the significance points, each of the scoring criteria, and you're going to provide a brief statement. If you can provide people anywhere in the grant application, but it's even easier if it's in the specific games page, the answer to that question. So if I'm going to fill out a review and I think it's innovative, I am looking for an easy way to fill that out. I want to find a statement that I can cut and paste from the application into the review that should somewhere, if this grant application is innovative, there should be something that where the applicant said, this project is innovative because. And if I can find that clear statement and cut and paste it, then my day's been made. I'm easier. And one of the things you want to do through your specific games page and through the whole grant application is make life easier for your reviewer. You make life easier for the reviewer, they're more likely to like your grant application and give it a score. So now I want to talk a bit about what's hard about writing the specific games. And I think that given the importance that I've just emphasized, it's already clear what's hard, right? You've got one page to sell your whole project and explain everything and all the details that you've been working out over 6 to 12 months and get it right and get it clear and get it detailed and get it exciting and get it everything. So that's incredibly hard in and of itself. Obviously, the hardest parts are going to be all project specific. How do you do that for your specific project? And I really can't answer that for each of you. But what I can do is talk about two concepts that are hard to do when writing, but give you perhaps an ability to think about how to do this. And I want to talk about the narrative of the specific games page and some thoughts on focus. So with regard to the narrative, a narrative is, by definition, a spoken or written account of connected events, and it's a story. And the specific games page really should be a story. It should flow. It should take the reader and hook them, get them excited, take them on a journey, and then take them to a resolution. And that's what's going to engage the reviewer. So that might be a little different than what people have told you. And you might say, gosh, that's not exactly what I heard. I heard that it's supposed to be like an elevator pitch. And, is that really a story? And what I can say is that, the elevator pitch really is a story too. And so this is the classic elevator pitch sentence structure that you'll find, in any business class or text. And the elevator pitch sentence structure says, for a target customer who has a certain need, I've got a product that's in this category that will have this great purpose and product that's unlike the competition, and this is how it separates. And that really is a story too, right? So you've got a character, you've got a main character, the target customer, and the target customer has a problem, there's a crisis, and lo and behold, a hero comes in, a product that has certain powers and abilities that are going to save the day, save the world, vanquish the competition, and the product will create a better world and make your life better. And so even the elevator pitch really was a story. And that being said, I think you can think about this that way, or you can really think about it in the classic sense of a narrative arc. And so if you take a creative writing class, if you ever take a creative writing class, or really just are a purveyor of popular fiction or popular movies, you see this narrative arc, and the narrative arc is how almost all stories work, with the possible exception of a David Lynch movie or a Kurt Vonnegut novel. But you start with an exposition, something that sets out a problem, then there's a complication, a situation, and then the complication, something gets worse, some crisis results, and then the hero creates a resolution, and then there's a coming together and a final resolution. This really maps out directly to what you can write in a specific games page. So in the specific games page, you're going to start with some kind of background. Here's what the clinical problem is that we're going to try to solve. Here's the venue, the situation. And then there's a specific challenge, though, that if we could only know, this biomarker, if we could only know this chemical mechanism, then we would be able to make a big difference. It leads to some overarching goal. This is the problem we're going to solve by resolving this challenge. And then there's a hero who comes in with a specific solution to the problem. And by the way, the hero is you, right? So you're the one who's going to come in and save the day with these specific aims, and you're going to vanquish this problem and lead to an impact, a significance, an innovation in patient care. Wonderful things are going to happen for all these patients that were suffering before. So this is the arc, and this is the story, and you want to be part of that story and teach it. So we'll get back to that when we talk about the structure a bit. Focus, I think, is sometimes even harder to do, and parts of focus are easy, right? So the specific games page focuses on the specific games. If this guy, blue guy, represents the specific games themselves on your specific games page, it's not hard to tell here that he's out of focus. And you can spend a lot of time wordsmithing and resolving and making very clear your specific games so that your specific aims themselves need to be incredibly focused. And that's something I think everybody would agree with, and probably pretty doable, right? I mean, you can focus your specific aims and make them work and make them very doable, explicit, and so they're fine. That's not the hardest part of focus. The hardest part of focus is that that's not the only thing you need to keep in focus. There's also the big picture, the impact. And the impact has to not only be there, but you have to be able to sell it with enough granularity so that people can understand it. And then there also has to be enough of a backstory. There has to be enough methodologic detail so that people can trust you that you're going to be able to accomplish this, even on this very, very limited page. And so ultimately, you need to have a specific games page that, to the best of its ability, is focused both in the way you set up the problem in the beginning, the specific games themselves, and the details that will allow people to trust you and believe in you. And creating this depth of field, to make an analogy to photography, is to marshal all your photographic resources to be able to have a depth of field that focuses on the specific games, but also keeps these other items satisfactorily in focus. And that's challenging, and it requires writing and rewriting and rewriting. If there is one page of your grant application that you need to share with other people, with colleagues and friends, and probably your people who work in this area, as well as people who work out of the area, because the panel is not going to be all people who have expertise in your particular area. It wouldn't hurt to actually have friends and family who are lay look at this as well. And this is one page that you just want to write and rewrite and rewrite until it's as good as you can get it. So I'm going to then suggest a specific structure for you for a specific games page. And like I said, this is the part that is purely a matter of opinion. If you look online for other suggestions and templates, I think that this will have a lot of similarity to what you frequently see out there, but everybody has their own ideas for what makes a good specific games page. It probably varies from project to project what makes the best games page. So all I can tell you is that for sure is that this is what I like and what I've seen work for other people through different reviewers, but there's no right answer for that. So roughly speaking, this is the structure that I would suggest for a specific games page. It really follows the essay structure that you were taught in elementary school or middle school, where you were told that there was sort of an upside down triangle, and then a thesis, and then a body, and then a conclusion that's like a triangle as well. The introduction starts out very broad and general, and then narrows down to a specific focus, and then you have, and I roughly suggest that be about a third or a quarter probably of the page, probably about a quarter of the page, and then a sort of extended thesis statement that's really your goal and statement of purpose, and that's probably a quarter of a page as well, and then a specific games themselves blocked out, and that's perhaps another third of a page, and then whatever's left down there for the conclusion that starts, again, very specific with what you found or what you're going to find, and spreads out to talk about why that is so significant and innovative and impactful. So whenever possible, I like to have a short, informative title that is the title of your grant application repeated here on the specific games page, only if you have space. And I got to say that I very often don't have space, and so I lose it there. But I think it's helpful when you can just remind people. But if they don't, I mean, it's on the front of the grant application. They're going to see it anyway. So I think that's okay. But if you have space, it's nice to have the title. I would say that the title of the grant application, whether it's on the specific games page or not, should be short and concise. It is very tempting to make long, inclusive grant application titles. NIH used to have a restriction on title length that was, I don't remember, 80 characters or 100 characters, and it was very limiting, but that was a good thing. And now they've changed it so that it's a 200 character or something like that length, and that's less good. When you finally publish in the New England Journal, they're going to restrict your character length to something less than 80 characters as well. And at first it's daunting, and then you realize what a wonderful thing it is. So you want to focus a clear, short title. They're going to get the details when they read it, but they want to get something concise as a title. And then you want to have a introduction and background section. This is where you educate people about the specific background that's needed for interpreting your grant application. You're going to identify key knowledge gaps, the needs. Why is there a problem? Why is your project necessary? And here I think you want to be careful. You don't need to spend a lot of time talking about what a terrible disease you're treating. I think you can assume that reviewers that are brought forward by the NINDS know that Parkinson's, Alzheimer's, stroke, all of these are terrible, and people know that they're terrible. They know that they're common. They know that they're devastating. Telling people that Parkinson's is a big problem is not necessary. What you want to do is tell people why the thing that you're going to address about that disease, why your particular problem is so bad for people who have this terrible disease. You want to tell them what they don't know. Don't spend a lot of time telling them that, this terrible disease, but do tell them why it's a huge knowledge gap that people haven't done your project. And then the next thing is the specific problem that you're going to be solved and the overall goal and solution to the problem. So this is going to be how you're going to solve this problem. And I say that deliberately. It's not just how is this problem going to be solved, but it's how you are going to solve this problem. So this is your chance to sell not only your solution, but you as the person or team to implement this solution or identify this solution or make the solution work. This is a part where you need to tell them why you're wonderful and great and perfect as well. And that's important because that's one of the scoring criteria. And it's one of the things that people are least comfortable doing, at least. I mean, there are some people who are very comfortable at self-promoting, but most of us are not as comfortable at self-promoting and downplay selling why we're the right team or person or group to do this. And this is not a place to be modest or humble. This is like when you're going up for promotion, you have to sing your praises because no one else is going to do it here if you don't. So it's going to be how you're going to overall solve this problem. And then you go into the bulleted specific aims, and I think they should be bulleted. Here there's probably a much broader range of opinions on how these are to be structured and what the best way to structure them is. I tend to think that the right number of specific aims is 3, and I don't have a great reason for why it should be 3. 3 is just what people are most used to seeing. It's what they're going to be most comfortable with out the door. 2 seems like often just not quite enough, and 4 just a little too many. I don't know why. I think that if the project is right for 2, then 2 is perfectly acceptable. If it needs to be 4, it needs to be 4. That's okay too, but it should have a purpose, and if you're not sure, then 3 is certainly your starting point. In clinical trials, that can be pretty hard, right? Because if you think about a clinical trial really should have one specific aim. It's the primary objective of the trial, and that's really what it's all about. So, conceptually, you could think of just one, but usually you have additional information you're going to learn. You have one primary aim, usually you have secondary aims, and the structure that I think is easiest to write is that specific aim 1 is your primary outcome, specific aim 2 is all of your secondary outcome. Here's all the other things that we're going to learn. And then I like for a third specific aim then the exploratory things, the things that you're not designed to be able to answer at all, but things that you can learn about that'll perhaps be a little bit more broad and open-ended. And now some people will tell you that that's a weak specific aim because you can't prove it, and it's maybe too vague. And I think that that's a justifiable criticism. That's a reason why you might not want to have an exploratory third aim. But I think that if you have 2 really good solid aims first, people are going to give you some slack on that and let you put the things that you wanted to say that you couldn't say without overstating in your other aims. So that works for me. I think you can certainly, like I said, do fewer or more. Within each specific aim, how do you structure it? I like a clear conceptual statement followed by a more detailed, specifically worded statement that is your hypothesis. You can label it your hypothesis or not, but I think that's what I like to see. Some people will structure multiple hypotheses under a specific aim, and that can work. I think that it tends to get very crowded and indecisive. There was a movie called Wonder Boys, which was about a creative writer, and one of the things that he taught as a writing professor, he taught his students was that writing was all about making choices. And then he wrote a 3,000-page novel, and one of his students said, "It sounds like you made no choices." So you do need to make choices, and you do need to create a specific hypothesis that is narrowly focused. And if you do hypothesis 1A, 1B, 1C, you really run the risk of looking like you don't know what you're doing. So it can be done under the right circumstances, it's appropriate, but I wouldn't be happy about doing that. And then I think that one of the things that a lot of specific aims pages miss out on, and I think is a mistake, especially in the current review environment, and that is not wrapping up by saying why this is significant, why it's going to change the way that things are done in this research field or the way that things are practiced in this type of patient care, and sort of saying that succinctly why this is significant and innovative And that's because significance plus innovation plus approach are what contribute to impact. And it's hard for the review division to get reviewers to focus on impact, but they're trying and they're trying and they're trying. So something that reviewers always like looking at methodology because that's straightforward, it's easy, it's relatively objective. If something's not going to work, they can tell you why it's not going to work. But impact and significance really gets into this subjectivity that reviewers often are uncomfortable with. They don't want to say that something out of their field isn't going to have a big impact, even if they feel that way, because they feel that that's soft and subjective. But that's what the review division is trying to get them to do. And so if you can sell them again at the end on how this all resolves and gives meaning and a purpose and a value, that's going to be something that they might believe. And certainly if they have believed it, again, it gives that soundbite for them to cut and paste into their review. So it's very important to leave with an impact. So that's my brief summary. Specific games pages are critically important. Writing them is really, really hard. But if you tell a story and you keep a wide focus and you consider a template as a starting point, it's doable. And everybody ends up doing it, and you'll do it, and you'll just see how well you can do it. So then this link is a link you can look at now. If you want to take a few minutes before the discussion, we can just open the discussion. But this is about 4 or 5 specific game pages that I was able to collect from willing volunteers. They're not examples of particularly good specific game pages or specifically bad AIMS pages. They're just AIMS pages that give you some examples of what some other people have done. And we can use them as a jump off for discussion, or we can just discuss things that on a wide open basis. But that's all I have. And what you want to talk about.
Can I ask a question?
You may.
I've heard conflicting recommendations from 2 different mentors about the hypotheses. One mentor suggested that the hypothesis should be as specific and concrete and even quantitative as possible. Another mentor said, no, putting in sort of quantitative values in the hypotheses is unusual and shouldn't be done. You should put that in later. Do you have thoughts on that?
So my first thought is this is one of the things that you're going to run into. It's like in medicine, right? When you have 2 different attendings and one of them tells you that you should always treat patients this way and the other tells you should always treat patients this way, and you have to figure it out for yourself over time. There's no right answer. I think that specific for a clinical trial, I think that it is important to have the specific hypothesis that you're going to test as part of the specific game. So I think that my preference is to have specific game 1 be your primary outcome. It starts with the general statement of what it is that you're trying to accomplish, what you think that the hypothesis means, and then I follow that with the specific hypothesis. We will, so we'll find out if this is an effective treatment for this disease and this condition, and we will specifically determine whether there is a greater than 15% improvement in this measure in a patient population that is selected for this compared to a patient population that did not get the intervention. I think it is helpful for that specific hypothesis that is the hypothesis you will in fact be testing. I think that's helpful. But It's not absolute. And then realize that that's not going to be possible if specific game 2 is all of your secondary outcomes, right? So if the second game 2 is all of your secondary outcomes, then you won't be able to have all of the specific hypotheses you're testing. There you'll have more general. But that's just one approach. I don't know, Will, do you want to jump in on that?
Yeah, I mean, I think if it might depend on the situation and the understandability of the measurement. If you want to reduce somebody's, a population's blood pressure 3 millimeters of mercury, and that's your hypothesis, it does, I think, help the reviewer, or at least when somebody spells things out like that, like what is it that they're going to measure in this study, and how are they going to define whether they succeeded in measuring that? That helps me as a grant reviewer to know what is going to define success for the study. Some studies are going to have more qualitative aims, define this or characterize this, but I think it's a little harder as a reviewer to necessarily understand those things. And pertaining to clinical trials in particular, a large portion of our goal is to get you to an answerable question for your early phase trial. And there aren't, really absolute and firm guidelines as to what exactly are the questions you need to answer in an early phase trial. But I think if you're submitting it for grant funding with a specific aims page, making sure that people clearly know what your bar for success in the trial is, or what your bar, or what output you're going to have, I think is really important.
Thanks.
Did you want to pull up some of those examples, Robert, and kind of, or we can certainly have another question while he's pulling that up.
Hi, this is Ramnath. Yeah. This link doesn't seem to open, so I was wondering.
You have to go to the chat. It'll open if you go to the chat box on the side. Since he's sharing a video, you can't. He would have to give you control of his screen, which he is not willing to do for that link to become active. So if you hit the chat box on the right, the link should be in there.
Hi, can I ask a quick question while that's happening? Do you ever, do you, in kind of along with what you were saying, Dr. Silbergleit, do you actually mention any of the any basics of power calculations or any of that stuff, or is that way beyond, even for a clinical trial, that you would include at that point?
So I would not. I mean, I think that there's, you have to pick and choose, right? Everything that you it's right. It's one page still, right? So everything that's in your specific aims page is going to be unpacked into a broader amount of information in your next 12 pages, right? So the 12 pages should relate section by section to what you said in your specific aims, and so there's inevitably going to be more important detail than you can say about it. So I think that the power is a detail that needs to be included well in the body of your grant, but is very hard to fit into the aims page itself. Obviously, it depends on the specifics always. Any of these answers mean or have that caveat of it depends on your circumstance, but.
Thank you.
There's a very good question in the chat box, Dr. Silbergleit. Are there keywords that you really like to see or really don't like to see? Do you like to see the word robust?
Well, I mean, there are words. There are words that I think are just tired words. Robust is a tired, overutilized word. But I don't mind robust. I think that I like to hear a specific statement relating to the things that I need to score people on. So I don't think one needs to be too flowery in one's writing. There is absolutely nothing wrong with saying this project is innovative because, and saying why it's innovative. This is significant because. This is our team is well prepared for this because. If you have very long sentences, then that's where you should write. You're probably overly complex, right? Break it down to smaller, easier to manage sentences. You can write very simply. Think Ernest Hemingway, right? You can have short, powerful statements. They don't need to be,
It's easier for the reviewer to understand if it is direct and doesn't have a lot of explanatory clauses. And I mean, yeah, some of this is sort of elements of style stuff, but as Dr. Silbergleit points out, if the reviewer has to read a sentence 4 or 5 times to kind of figure out where it's going, they're going to be a little irritated because they're going to probably have to like look through the rest of the grant, which they're going to do anyway, but having that sense as to what are these folks looking at, right? Is aspirin plus clopidogrel superior to aspirin alone in minor stroke and TIA? Okay, I got it. So, they need to be able to walk away from that page with what is it that they're testing. And in the early phase trials, it's harder because you're not going to have it's a lot easier to write the big trials when you have the right preliminary data from the middle phase trials and the biological data. It is a hard problem for our early phase trials, but that means we have to have the best direct language to let people know exactly what we're going to learn and that it's important.
Yeah. You want to, like I said before, you want to make the reviewer your friend, not your adversary, right? You're not playing against them. You're trying to sell them and get them on your side.
And then because they are literally putting it out there for you to a vote of the 20 panel members. So if you can make them your advocate and get them excited about your project, then your chances will be substantially improved. Were you going to share some of those pages from the or were there other questions first?
Well, I was just going to suggest people take a minute or two to look at them and see maybe share with others what they liked, what they didn't like.
And certainly, if you can either speak up or you can send messages over into the chat window on the side, which we'll watch.
So I'm looking at these specific aims for the very first page. So you just mentioned that you wouldn't want a specific aim 1A, 1B, and 1C because it might sound like you're all over the place. But the very first project where it says evaluate the clinical effect of esmolol treatment on cardiac function, electrophysiology, they do have a 1B, 1A, 1B, and 1C. So how do you guys see that?
I think these were meant to be illustrative examples for discussion. So I'm a little, I have a conflict of interest on that since those were ones that I wrote. But I will criticize them because I wrote them a long time ago when I knew less about clinical trials than I do now. So I think it's in that I was trying to balance these two situations of is this what was it that I was trying to show in this study? And I was trying to show that esmolol could protect the heart after subarachnoid hemorrhage. And by looking at this, I was going into specific measurements in this sort of early phase proof of concept study to look at very specific measures that I thought we could change. So that was why I kind of did a lot of this splitting in terms of these different things, is I was I was trying to get the reviewer excited about the all the different things I was checking. But I agree. There is I could have spent more time here getting them excited about the concept of we can protect the heart with this agent, and probably annotating all of these things in this real estate wasn't a good use of the space.
Yeah,
And
I mean, like I said, I agree. I didn't, like I said, these are not, I think all of these, some of these are ones that we wrote, and others are ones that we didn't write. And I'm critical of both things that I've written and things that other people have written. I think all of these, none of these I think are impossible to improve. And I think that the multiple hypotheses in the first one, I think if you're going to do multiple hypotheses, this seems like a pretty reasonable way of doing it. And sometimes it will be necessary, especially in an early phase study. It's not my preference, but they're not absolutes. These are all relative.
in another quirk of my writing style, I think you will see that there are absolutely no apostrophes on that page. I just hate apostrophes.
I feel like a lot of these early phase trials may have sort of exploratory aims or sub-aims. In that case, is that okay to put it as a 1A, 1B, or and in parentheses say that this is sort of an exploratory sub-aim and things like that? What do you think about that?
Yeah, so I think that I think exploratory aims, I don't think you want to draw too much attention to purely exploratory aims.
Yeah.
So I think that you want to try to hit the sweet spot with exploratory aims where you toss it out there so you know that there's sort of this more far-fetched, open-ended thing that you can't really define particularly well. You won't necessarily be able to deliver anything substantial on, but it's really exciting and it's something that you'll learn about. And you want to try to get people, include that so that people are excited by that, but not have people rely on that, because no one really, ultimately it comes down to very few people are going to want to fund you just to go on a exploratory mission, especially in the clinical trial space. They're going to want to know what you're going to do, what question are you going to be able to definitively answer, specifically answer in an actionable way. And then once you've done that, if you can learn some other things too, that's great. But if you make the thing that you're going to answer specifically 3 or 4 lines long, and make the things that you're going to explore in a sort of general way 8 or 9 lines long, it's out of balance. It makes it look like you're not really doing this to answer that question. You're really doing it to do the exploratory stuff. And the question that you made up along the way for your primary outcome is just because you had to come up with something specific. And so you chose something specific, but it doesn't really matter. The thing that you choose as your primary outcome, that's the first specific aim, has to really matter, and it has to be more than exploratory.
And some people will say that they would like, as reviewers, they would like to see, obviously, a power or range of powers under some assumptions for the primary aim, for sure. Many will want to see power, even if it's lower for secondary aims, so to speak. People will often be a little bit more lenient about power for exploratory aims, but I think you do have to focus on the things that you're going to be able to definitively answer, the primary aim. And things that may draw attention, somebody's going to be like, gosh, they're doing a stroke reperfusion study. They don't seem to be thinking about collaterals at all. If you could, throw that in there as like we will be doing some exploratory analyses on this, But to me, I don't even know that that really belongs on the specific aims page. I think it's there later if people are like, oh gosh, this is missing. If it's crucial and it's not there, then it'll be a problem. But I think a lot of the more exploratory aims ought to be defined, but I think you want to dedicate your real estate to the stuff that you're going to be able to definitively answer. I think one of the other questions was the structure of the specific aim page, depending on whether this is a career development award or an R. I think, I guess the partial answer to that question, and I'd be interested if Dr. Silbergleit, I mean, I think by full disclosure, neither he nor I have had an NIH Career Development Award, but at least I don't think he has. I know I haven't. I think one of the issues with that is you do have training and development aims along with the scientific aims, and you do have to dedicate some space to both of those aspects. That's a good question. I think we could probably develop our answer better on that. If there's anybody else on the call from the faculty side who has more insight into that, I'd welcome comments. But I think, to me, the major difference is addressing some aspects of your development along with the science. And I do think that the science tends to get weighted heavily, but you do also need to weigh heavily what you are going to be doing to develop yourself during the Career Development Award, because that's obviously crucial as well.
Yeah, I agree. I've not been on the K panels, so the limited credentials I have for specific games in clinical trials doesn't apply to the Ks.
Right. Dr. Silbergleit, what's the favorite specific aims page that you've seen? Have you ever seen anything that just really, how about graphics? Do you like a picture on the page? A diagram? Do you like to dedicate a little space there?
So I don't. I think that unless it's, I mean, I've never seen one that was worth the number of words that it replaced. So, I think that your favorite specific games page should always be the last one you wrote, right? So, I hope my favorite specific games page is the last one I wrote. What about you? Have you seen something novel? So it's, you don't want to be too. It's sort of like when you write, your application letters for medical school. You don't want to be too interesting, right? You want something that stands out, but not something that makes you weird.
No, I agree. It's not an area of innovation, but yeah, getting the things, but I do think your idea, which is maybe not always intuitive, but in terms of the review criteria at NIH, innovation, significance, innovation, approach is weighted very heavily, and that bears out in the data they do from peer review. But significant innovation approach, the investigators and the environment, it can be helpful to highlight the strengths of those. Again, if people are going back to the specific aims page when they're reviewing and they're looking like what's the underlying premise, and the premise is the retrospective review of the preliminary data that is you are putting forth in your study when we talk about our significance sections in those sessions to justify why the study should be done. So Robert, next question from the chat room. Is there a disadvantage with need-driven proposals when compared to hypothesis-driven proposals? I guess my gut feeling is a need-driven proposal. I don't know if there is specifically an advantage or a disadvantage. I guess it is important to.
What's the difference between a need-driven and a hypothesis-driven?
I think just demonstrating an unmet need is an important part of a specific aims page, but the objectives would tend to be, I guess, we need a new treatment for stroke that is safer and easier to use than TPA. But it would seem the hypothesis is TNK or Agent X is at least as good as TPA and easier to use. So yeah, we'd be interested to hear more what you may have heard about a need-driven proposal. If there are specific different mechanisms, we are a little bit tilted towards a clinical trials R01 on this panel, or potentially a K23 focused, with a clinical trial under those new announcements. Other mechanisms, small business innovation, they may have different instructions and different review criteria, and maybe DoD and other places have need-driven proposals. That's not to say we think that they're bad or good, but typically, in an NIH review panel, a hypothesis and a measurable outcome is an important aspect on that specific aims page.
Yeah, I don't know what the difference is. I agree. I think that the hypothesis is the answer to your need.
So I think at this point, we are going to probably wrap up. Joy, did you want to pop a link for the evaluation into the chat box?
Sure. Hold on one second.
So just while she's pulling that up, just CME is available for these. There it is right there. If you click on the link in the chat box, it's also should be in your syllabus. Also, the constructive feedback about the content and ways that we could make these sessions better for the future is something we use to make adaptations and improvements to the course each year. I really want to thank Dr. Silbergleit for taking the time to talk to us today from his awesome conference room there at Domino's Farms. And I would hope that you guys, or you trainees and everybody else, can start using some of these lessons to help continue to revise the specific aims pages you're working on in the small groups. We will be likely getting a draft of where everybody's going to be at what times for the residential course soon. So we're working on that as so just within a few days, you should hopefully be seeing the early draft of what that's going to look like. So again, thank you everybody for your time, and please have a good rest of your afternoon. Oh, and then hand it over to Joy.
I just wanted to mention that our next webinar is about where do outcomes come from, and it's on Monday at 12 noon Eastern. So I hope you guys can join us then too.
And we will try to get these up onto the internet or YouTube as soon as possible. We just have to work a little bit on the video processing. So we'll send a message when we have this one up.
Right. Thank you.
But I did this one in 2016, and that one's up. So if somebody needs to look at it tomorrow,
you can search for Dr. Silbergleit on YouTube if you want to see what the beginning looked like. The beginning was pretty similar. The end, I don't know. We did some unique things this year. All right. Anyway, bye everybody. We'll talk to you later.